Welcome to another episode of In Good Health with McLaren Macomb. I'm Toya Hankins. Today we're going to be talking with Dr. Schendel about lung cancer screenings. And then we'll learn more about the McLaren Macomb Vein Center. But first, we're here with Dr. Richard Reidy, emergency medicine physician, discussing summer childhood safety. Welcome, Dr. Reidy.
Well, thanks for having me, Toya.
How's everything?
Very good. A busy time in the emergency department, but we're used to it.
Okay, well, tell us a little bit about what you do in the emergency department.
Well, I'm a board-certified emergency physician. Spent the last 35 years practicing full-time emergency medicine here at McLaren Macomb. So we're used to taking care of emergencies, and especially during the summer where things get a little more active, people are more active, and they're outside, spending more time outside, and at the same time they're at risk for injuries and illness that are unique to the summertime.
Okay, and I'm sure parents are eager to get the kids out of the house, and kids are eager to get out and play. And so do you find that you see a lot of children in the emergency room in the summer?
We do. We tend to see more, fortunately, mostly minor injuries in the emergency department. Because kids are not in school in a controlled environment, they tend to be outside, running around, playing around, swimming, and they're a higher potential for injuries.
What kind of injuries?
Well, fortunately, most of them are minor, cuts, scrapes, falls. We always emphasize when kids are out riding their bikes to wear helmets, because that's where a minor fall can turn into a major problem when a significant head injury. We're also very concerned during the summer about drowning and water-type illnesses. The drownings are just so tragic. It's the number one cause of death between the age of 1 and 5. And surprisingly, drownings occur most of the time in the presence of two caregivers or two parents. So
how do you think it happens? What do you think?
Well, they've studied
high numbers.
They've studied this, and those of us that are parents know that when two people are watching a toddler, sometimes you think the other parent is watching, and the other parent thinks you're watching, and the reality is no one's watching.
Right.
And it doesn't take very long for that 2 or 3-year-old to slip out of your sight, get in a pool, and you don't hear anything. That's why they call it the silent killer. So we always emphasize to parents, especially when during the summertime, that when they take their kids swimming, to leave their cell phones at home or away.
Focus.
No reading material, to totally focus on the children in the water. Don't be distracted. If there are two parents, have a clear designation of who's watching those kids. And that really cuts down on the number of drownings.
Yeah, and I'm sure in smaller pool settings where there are lots of kids in the pool, it's easy for a kid to get caught under the water or
Correct.
things like that to happen.
You're absolutely correct. And the majority of drownings occur in residential pools.
Wow. Yeah, well, that's some great advice, for parents to come to that environment very focused and clear about who's doing what, who's watching the kids at the time.
All of us emergency physicians have experienced a young toddler that has drowned, and it's just etched in your mind the pain that those parents have to endure. We just never want to see it again.
Yeah. Are there other injuries that you see that are pretty prominent in the summertime? Like, especially, we've had quite a few really hot days this summer in particular. Is that a threat for children?
Yeah, that's a good point, especially when the weather gets warm like this. We have to be mindful of what the temperature is going to be, what activities we're going to be engaged in, and plan appropriate. We do see heat illness, heat stroke occasionally.
In children?
More so in adults that are out working on the road, especially road workers that are in construction, that may exert themselves too much and don't drink enough water and don't get out of the heat, and they end up with heat illness, heat exhaustion, or heat stroke.
I know that Powerade and Gatorade are popular drinks for hydrating. And is that really the case?
They are very popular, and I think they're okay in small amounts. I think what's much better is water and supplementing that with a small amount of the Gatorade or electrolyte solution drinks. But you don't need to constantly drink Gatorade or these sports drinks, because they do contain a lot of fructose and a lot of caffeine, some of them.
Things that dehydrate you.
Exactly, exactly. So I think water is best. However, a small amount of the sports drinks are fine too.
And so if someone is affected by the heat, is it noticeable if I'm with a child or with an adult or a senior? How would I know that there could be a problem happening?
Well, it's kind of a spectrum of illness. The first signs are you start feeling tired. Okay. And you notice that in kids, they're just not as active as they should be. In adults, they may be less conversant. Then they start to see where they don't sweat anymore. Usually our response to heat is to have perspiration. When they start not sweating, then the cooling mechanism doesn't occur and their temperature starts to rise. And when it's really serious is what we call heat stroke, is generally in a setting of a core temperature of the body over 104 degrees, that a patient starts to feel neurological changes where they're a little confused or they're disoriented. That's where it's a true emergency and they have to be removed from the hot environment they're in and initiate cooling therapies as well as hydration.
And cooling therapies meaning just applying cold compresses, or are there some ways to quickly cool the body?
There are.
That are safe?
Correct. In the pre-hospital setting, the most important thing is to get them out of the sun, to get them out of the hot environment, get them in an air-conditioned setting, and then offer them cool liquids. And like you described, cool compresses until we can get them to a setting where we can monitor their core temperature. If their core temperature is 104, 105, 106, these are medical emergencies that warrant rapid cooling. And in the emergency department, we may put a wet sheet over them and cover them with ice to rapidly bring down their temperature.
And at the point that it's determined that the temperature is that high, then call 911 and get to the emergency room.
Absolutely. If they're showing neurological signs of confusion, disorientation, they're just not themselves, especially in the elderly where they may be taking medications that affect their ability to cool themselves, they need to be seen quickly.
And this might be a really simple question, but I'm curious. We see so many sunscreens on the shelf, now ranging up to 100 SPF. What's a good number, to protect the skin and to avoid skin cancer or, things like that, or burns that would cause a need to come into the emergency room?
Well, I think the most important thing is, one, use the sunscreen. You can buy all these spectrum from 30 to 100. The most important thing is apply it and apply it regularly. Number two is to protect yourself from the sun. Don't get in that direct sunlight for long periods of time. Certainly we're all active. We're not always going to put a hat on or sun umbrella or anything like that. So we're going to get minor exposure, direct exposure to the sun. However, if we know we're going to be outside for long periods of time, then we should wear a hat or wear covering our skin so it doesn't get that direct sun exposure. But to say, oh, you absolutely have a 50 or 75 or 100, I think it's more important to use it regularly. And if you're going to be out in the sun for long periods of time, cover yourself with a hat or appropriate covering for the setting you're going to be in.
Okay. And what's a good amount of water to take in? Is there a standard depending on your size or amount of activity, or?
As a rule of thumb, I think you should, like we talked about, drinking water, small amounts of sports drinks are fine. But also, when you start to develop thirst, that tells you that your your body needs a little more fluids than you've been taking in. So listen to your body. When you start feeling weak, when you're thirsty, stop your activity, get out of the heat, drink appropriate amount of water. If you feel good, continue with your activity. I guess it's more common sense than an absolute formula.
Okay. I've heard, I've read before that half your body weight in water is a good amount for you to take. I'm not sure if that is just,
Yeah, I think I'd go more, have it symptom driven than an absolute volume amount.
Got it.
I think it's easier to follow because who keeps track of how much water we're drinking? You're active, you're distracted, you're with kids and whatnot in the summer. So it's hard to kind of quantitate those things to make sure you're on track with your fluid intake. But if you notice, boy, I'm getting tired, it's been an hour since I had anything to drink, then listen to your body and take in some fluids.
Okay. And one last set of questions regarding kids and head injuries. Falling off of bikes or climbing trees or jumping off of the garage roof, the things that kids like to do. How would a parent know when it's time to bring a child into the emergency room? Because sometimes we'll look at a fall or a bump and just, watch the children for a little while to make sure that, they're okay. But when should we be alarmed?
In a general rule, a toddler that falls from standing onto a hard surface generally is not going to suffer a significant injury. That said, I've always said if a mother's instinct feels their toddler or their child's injured, follow your instincts. If you think, boy, they're just not acting right after that fall, get them checked out. We can go through them thoroughly in the emergency department. Fortunately, most head injuries that occur in the younger age group are minor, don't result in serious head injury, and don't require CAT scan imaging or skull x-rays. It's important to try to get as much information about the fall as possible. If the parent didn't witness it, try to contact the kids that were with them or other adults to get a sense of the energy that the child absorbed in the fall. Certainly falls from ladders or heights or garage off roofs, those need to be investigated. But minor falls from standing and most falls off bicycles and things like that generally are minor and don't result in serious injuries.
Okay. Well, thank you so much for the information.
Well, thanks for having me.
This has been very helpful to many of the parents watching. We appreciate your time.
Thank you.
To learn more, visit mclaren.org/Macomb Safe Summer.
Now let's visit the Vein Center in Clinton Township.
If you call Clinton Township home, then you know it's a great place to live. And one of the great advantages to living here is our proximity to some of the finest healthcare providers anywhere. McLaren Macomb Hospital has long served Clinton Township residents ever since its humble beginnings as Mount Clemens General more than 70 years ago. McLaren has continued a long-time tradition of adding new services to improve the health of area residents. In March, they added a new Vein Center in a beautiful office building on Garfield Road, just north of Metro Parkway. Township Supervisor Bob Cannon, along with Trustee Ken Pearl and Clerk Kim Meltzer, talked all about the Vein Center with McLaren Macomb President and CEO Tom Brissy.
Tom, you have something special here for us in Clinton Township on Garfield. Tell us about it, and tell us a little bit about the perception that people think this is, but it really isn't just that.
Sure. Thanks, Bob. Well, today we're having a ribbon cutting on a brand new Vein Center that is owned and operated by McLaren Macomb Hospital. You see Vein Centers all over the market, but what makes this one different is that our Vein Center is staffed by 2 board-certified vascular surgeons who spend all of their training and all of their clinical practice with expertise in vascular clinical care. And so what a lot of people think about when they think about vein centers is the aesthetics of people getting spider veins and varicose veins taken care of, but there's a much larger side to this clinical practice that has to do with people that have restless leg syndrome, achy legs, heavy legs, swollen legs, almost always having to do with clinical conditions and vascular conditions, and we can take care of just about every one of those things right here at this practice.
My wife has beautiful legs, but she does have restless legs. And Ken, I think your wife does too. Tell us what some of her symptoms are.
Well, she just can't get to sleep. It's restless. Her legs feel heavy, and they keep moving. She keeps moving them and can't get them, to settle down. And I think this would help.
So now that I've heard this, I'm going to have my wife get with your wife, and they're going to come over here and try to settle this problem, because restless legs is a big problem, and they hurt. And Kim, Garfield Road, filling in a nice office complex here. They're going to repave Garfield in front of this building here soon this summer. Tell us your thoughts about this.
Well, it's exciting that you're here, so welcome. This is a great newer facility. It's a beautiful building here, and what you guys have done inside is very nice. So I think it'll be a great attraction for people that need it. And I want to actually talk about the cosmetic side of it. Being a woman myself, I know that as we get older, we get those spider veins and varicose veins, and I think that option is also great to have, and I think it's wonderful that you're here.
Bob, I've seen a recent increase in ads for vein surgeries, but it's nice to know that McLaren has total control over this, and they're doing it. The operations would be at the hospital, but they do vein work here too.
We have state-of-the-art laser equipment here. We do most of the procedures here. When it becomes too complex for an outpatient setting, we take it to the hospital. The vein diagnoses are one of the most underdiagnosis problems in our community. So it's not that they're all competing, it's that we're starting to recognize that we can do a lot of good for people once they realize what our capabilities are.
All around Clinton Township, all around Macomb County, all around Michigan, you see McLaren signs. And you're in charge of all these in our area, of course. But McLaren is the biggest hospital in the state, isn't it?
Yeah, it's one of the largest. We have 12 hospitals ranging all the way from Petoskey down to Carmanos, which is part of McLaren, and everywhere in between. So, yeah, there's a lot of big health systems in Michigan. McLaren is amongst the biggest.
And one of the best, and we're proud of it.
Yes,
thank you for bringing this right smack dab in the middle of Clinton Township.
At McLaren Macomb Vein Center, patients are in the capable hands of board-certified vascular surgeons and certified professionals. These highly trained specialists are in the business of diagnosing the different conditions that lead to leg pain. For patients with swelling in the lower legs and ankles, especially after extended periods of standing, or pain, aching, or heaviness in the legs, you need to contact your doctor or contact the Vein Center. According to the Centers for Disease Control and Prevention, deep vein thrombosis, pulmonary embolism, or both, affect an estimated 300,000 to 600,000 individuals in the United States each year. And it's estimated that up to 100,000 of them die each year from these conditions. Chronic venous insufficiency, or CVI, is a condition that occurs when the venous wall and/or valves in the leg veins are not working efficiently. It makes it difficult for blood to return to the heart from the legs. CVI causes blood to pool or collect in these veins, and this pooling is called stasis. Left untreated, the complexities of chronic venous disease will worsen over time, and conditions should be treated as soon as possible to avoid incremental discomfort and deeper complications.
We're on a very cold night here on March 1st on Garfield Road to welcome you to Clinton Township again, Mr. Percy, once again, and also to introduce the two doctors who are in charge of your new clinic. So, Tom?
Thank you, Bob, and I want to welcome everybody to McLaren Macomb's brand new vein center. I think the only one in the county that is fully staffed by two board-certified vascular surgeons, and it's my pleasure to introduce you to Dr. Lynn Mathia and Dr. Greg Gaborik.
Thank you, and I'm here with Ken Pearl, trustee, and Kim Meltzer, our clerk, and Jim Purpose from our cable department to welcome you in Clinton Township. I know this is going to be a great facility. We've already got a couple clients all set for them, right, Ken? So thank you to all. Thank you to McLaren Macomb for everything you do in Macomb County and throughout the state of Michigan. So whenever you're ready.
Okay, let's go.
1, 2, 3.
Very good.
The new McLaren Macomb Vein Center is located at 38770 Garfield Road, Suite 100 in Clinton Township. For more information, call 586-349-1640.
To learn more, visit mclaren.org/Macomb Vein Center.
Hi, Dr. Schendel.
Hi, how are you?
Welcome to In Good Health.
Thank you.
We're happy to have you today.
Thank you very much. I'm happy to be here.
Thank you. So, Dr. Schendel, you're a pulmonologist. Will you tell us what that is?
Yes, I am a lung specialist, so I take care of people with diseases of the lungs such as asthma, COPD, and emphysema.
Okay. And is one of those ailments more prominent than the others?
We do have a large population of patients who have lung disease. Smoking has contributed to our population of patients with COPD and emphysema.
Okay.
And then
so they all kind of go together?
Yes.
Do you only get lung disease when you're a smoker, or are there other ways to contract a lung disease?
Smoking is one of the ways, probably one of the most common reasons people get lung disease, but there are other exposures that people may have in their homes or in their businesses, places
Exposures
of employment.
in what way?
Things that they may do at work, dusts, gases, fumes that they could be exposed to. Okay. And then some people have lung disease for not any particular reason, just something that they are having to deal with.
Is it a genetic dynamic, or can a person be predisposed because of their genetics?
Yes, definitely. Some diseases run in the family, some of which we don't know all the details about, but there are familial lung diseases as well.
Okay. And how would someone know to come in and have their lungs checked? Like, what are some of the symptoms or signs that would alert someone to go in for a checkup?
Most commonly, shortness of breath. Sometimes when they're just resting, sometimes they'll notice it when they're starting to exercise or do other activities. Also, things such as cough, any noises they may make when they breathe, such as wheezing, would be indications to come and see a lung doctor. Okay.
And is it difficult to test the lungs?
Not really. There's a couple pretty simple tests that we do actually right in the office to give us at least a starting point as to what might be going on.
And so will you tell us what does a lung screening look like?
So lung cancer screening, something fairly new that we've started, similar to what we do for breast cancer screening or colon cancer screening, is a CAT scan of the chest. So it would be pictures of the chest. You would lay on a table and the radiologist would take pictures of the chest to look to see if there are any small spots in the lung.
Okay. So who's a good candidate for lung screening?
So we do have good criteria for people who are at high risk for having lung cancer. Anyone between the ages of 55 and 74 who've smoked for 30 years, about a pack a day, and are either still smoking or have quit within the last 15 years would qualify under Medicare for free lung cancer screening.
Oh, okay.
Now that's just
even without symptoms?
Correct.
Just because of
because of risk factors.
Nice.
And that's a screening examination. From there, depending on what is found, other testing may be necessary to work up anything that we find on the CAT scan.
Okay. And if there are small spots, should a person become immediately alarmed, or would follow-up tests let them know if it's something serious or not so serious?
Right. So sure, anytime you hear that, it's concerning. Most of the time, we actually do find spots in the lungs, and most of the time, they're nothing to worry about. Okay. Depending on what they look like, the size, patients, risk factors, we would determine if something needed to be done, such as a biopsy right away, or if it's something that we could just follow.
Okay. And how does a person maintain healthy lungs? Like, what are good best practices for, keeping your lungs healthy?
Number one is not to smoke. That's the biggest thing. I think we all know that. It's a difficult habit to quit, but that's the number one thing. And protecting yourself from any other irritants in the air. If you know you're exposed to other forms of smoke, something else in the workplace, using protective equipment from that. And then other than that, just, healthy eating, exercise, good sleep, all help the lungs and the rest of your body.
Okay. And then if you are a smoker, I know, like we mentioned, it's a difficult thing to break. What kind of things should they be mindful of? Still exercising and sleeping and those things as well?
Still all important. Okay. But trying to quit smoking and finding the best way for each individual is very important to me and other lung physicians and other physicians in general. We have lots of options that we can use, support groups, medications, other kind of feedback mechanisms to help people quit. So looking into those options and seeing what works for each individual is really important.
Are the lungs the only thing that a pulmonologist would focus on in terms of good health?
The lungs are a big part of what we do. The heart and lungs work together, so we are often focused on some of the mechanisms of the heart and work closely with the heart specialists or cardiologists for that.
Okay. And how does lung cancer differ from COPD or asthma?
So lung cancer may occur in a patient with COPD or asthma, or may occur in somebody who has no other history of lung disease, or even those who don't smoke.
Okay.
So the treatments for that is quite different. When we say patients with COPD or asthma, they're similar lung diseases in that patients have difficulty in breathing and difficulty exhaling or letting out all their breath.
Okay.
Those are usually treated with inhalers and breathing treatments.
So how would someone develop COPD and asthma?
With regards to COPD, smoking is the #1 cause.
Okay.
Other smoke exposure in the workplace or at home can sometimes lead to COPD.
Secondary smoke
Yes, it can.
or secondhand smoke? Is that
Secondhand smoke,
Okay.
whether it be from cigarette smoke or those people who may work in professions where smoke, whether cooking, firefighters,
Okay.
less common, but it can happen. And those patients are typically older because it does take some exposure and some time to that exposure to develop COPD.
Okay. And what about asthma?
Asthma can occur in any age group. We see it in small children, and we see people develop it even in older age that haven't had a history of it.
And what are the risk factors for developing asthma?
Those are a little bit harder to determine. A lot of that probably is genetics. Some of that is contributed to with allergens that people may develop. There's a common link between allergies and asthma. And as I said, that can happen at any stage in life.
Okay. How difficult is the treatment plan for asthma and COPD?
The treatment primarily for those diseases are inhaler therapy. There are lots of inhalers that patients can be prescribed. And when we do prescribe those, we go into a lot of detail about what they're doing and how to use the inhalers, and in hopes of getting good control of patients' breathing.
Okay. And I've also heard about steroids helping with, increasing the lung capacity. Is that truly the case?
Steroids do help. They're a powerful anti-inflammatory. They come in inhaler form, and it often is a first-line treatment, especially for asthma.
Okay.
Steroid pills are also used in some patients who have flares of their lung disease and need some more anti-inflammatory medications in an acute setting.
Okay. So inflammation is at the root of lung disease? Or?
It is definitely part of it, yes.
Okay. All right. Well, thank you so much for joining us. That was really great information.
Thank you.
Really appreciate it. Take care.
To learn more about lung cancer screenings, visit mclaren.org/Macomb Imaging.
Thanks for joining us on In Good Health with McLaren Macomb. We'll see you next time.
To watch this episode again, visit mclaren.org/Macomb blog.